Still rolling.
What can we expect moving forward?
Well, the Supreme Court's decision to uphold the entire law, frankly, is a pleasant surprise on my part. I think that a number of analysts were and political observers expected a different outcome. But this is a great day, and this is a great victory, not only for the administration, but for millions of Americans who are now going to have access to affordable health care for the first time in decades. Starting in 2014, which is when the major provisions of the bill go into effect, upwards of 35 million Americans are going to have access to insurance, either through state Medicaid programs or through the private health insurance exchanges that are required under the law at the state level. The federal subsidies that are going to be available to people in the exchanges to buy health insurance are going to make health insurance affordable to millions of Americans for some for the first time in decades. So this is a great victory for the administration, but it really is a great victory for America because we are now going to move forward with what is the most significant piece of health legislation since the enactment of Medicare and Medicaid in 1965. We will have more Americans covered by health insurance under this bill than were covered under the Medicare program when it was enacted in 1965.
Well, lastly, can we expect any other state challenges to this debate, or can we say it's put to bed and we're moving forward?
I would suspect that the opponents to this legislation may not feel that the battle is over, despite the fact that the court has upheld the constitutionality of the law. So I would expect that based on the lack of progress that many of the states that brought the lawsuit in the first place have demonstrated in moving forward to implement this law, that lack of progress may in fact hinder the successful implementation of the bill in those states. And specifically what I'm referring to is the health insurance exchanges. The evidence is that the states that brought the lawsuit have not made much progress at all in moving forward to develop health insurance exchanges. So I have concerns that when 2014 arrives, that we might still see the federal government having to play a role in providing health insurance in states that have dragged their feet and not moved forward with the implementation of the bill.
Thank you so much for joining us here on Uncut.
It's my pleasure.